Welcome to the ultimate guide to new nurse success. Expert nursing tips and tricks revealed. Okay, let's begin. Being a new nurse can be overwhelming, but fear not. Shipwell Registered Nurse is here. I got you. Okay, your coach is here. In this video, I will cover some invaluable advice from seasoned professions. Seasoned profession, I asked, they answered. Okay, and at the end, I have a bonus for you. Choose the shift that is right for you. Don't rush in any shift job because of the anxiety of waiting, or you can't wait anymore to get a new job, ready to get a job. Please stick to the end. I will share with you my devastating experience in rushing into a job because I was a new nurse. Welcome to Shipwell Registered Nursing, where I support new grads from passing your NCLEX to coaching new or novice nurses to become gritty so you'll persevere and lead in the field. I am your coach. Let's shine. Jenny. Okay, number one, slow down. You are not trying to impress anyone at all at this point. Your main goal as a new nurse is to learn the necessary skills. If you are given, for example, you're given a medication, you're given an antibiotic to the patient, make sure you know why you're giving it, the name, the side effects you may anticipate, and all of that, okay? Number two, fully assess your patients. Don't follow seasoned nurses. My new nurses, new grads, I'm telling you, I'm going to repeat it. Don't follow seasoned nurses and take report at the bedside, okay? In the room at the bedside, not at the nursing station. Take report at the bedside. Most hospitals stress the fact for nurses to do bedside handoff. And trust me, you will learn why. I would advise you to do so. Always remember there are reasons behind why a rule or was implemented. While at the bedside, check the patient and scan the surroundings. So when you go in, you're looking, you're scanning the environment, you're making sure that the safety should be your number one priority. You're checking the patient for lines and the oxygen connected, and make sure that it's actually connected. Ensure the environment is free of potential harm to your patient. Bedside table is closed, call bell is within reach. Good. After you are done taking report, please take a couple minutes to look through the patient chart, through each patient chart, okay? You're checking code status, orders. Is there folder order? Is there tele order? If you're in a tele unit, okay? Ensure orders are active. For example, the patient has a Foley. Make sure there actually is an order for a Foley. You get it? Okay. Number three, treat your nursing assistants and your techs with respect. Don't feel you're high and above them due to your credentials as a registered nurse. They are very valuable to you. They are seasoned, and trust me, they know a lot. Practical, they got it locked. Than a new nurse, because with my experience, a lot of nurses, a lot of new grads, the only clinical experience you have is that clinical with your professor. So when you go in the hospital, your nursing assistants, they definitely will help you. I'm telling you, they are a gem. Treat them nice. Do you hear it? Treat them nice. They're a gem. Trust me, your nursing assistants, when you work together as a team, your nursing assistant, your tech, they will make your life much easier. Especially as a new nurse, you need that. You need that support. And I'm telling you, once you build that relationship with your patient care assistant, or your nursing assistant, or your nursing tech, trust me, your life will become easier. Okay? For example, I'm going to give you an example because I was a nursing assistant. And I'm telling you, I see new nurses come into the hospital. They don't know what's a bedpan. They don't know what's a urinal. They don't know how to start a pump. They don't know how to turn off a pump. And guess who they ask? They're nursing assistants. New nurses used to come to me all the time and ask me questions. Okay, tip number 4. Always prioritize your tasks. Create a to-do list. Stick to it. Tackle it. And make sure the most critical task first. Stay organized. Stay focused. You got it. Tip number 5. Be confident, but never be afraid to ask for help. Seeking guidance from experienced nurses will boost your knowledge and your confidence. Yeah. Tip number 6. Take breaks. Listen, take breaks. Take your break. Honestly, I have a problem with nurses not taking a break. I have a problem with that. Stop feeling guilty about taking your break. Prioritize your break. Take care of yourself, both physically, mentally, and stay hydrated. Drink your water. Eat well, and remember, take breaks. A healthy nurse is a effective nurse. Okay? Okay. Number 7. Follow your gut. Go with your gut feeling. Whatever you feeling in here, my sister or my brother. If you feel something has been changed with the patient, something is wrong, or you just feel like something is wrong. Patient 8 out of 10 times, I'm telling you, your gut feelings is right. You will save lives. I've done it. Tip number 8. Communication is key. Build strong relationship with your colleagues. Friends equal to smooth patient care. So keep that communication skill going. Communicate effectively with your colleagues, If in case you receive a negative feedback, because, trust me, that's going to happen as a new nurse. That's going to happen. Develop that thick skin because you're going to need it. Learn from it. If there's a feedback, it's negative, learn from it. This is where you're going to learn. Remember, you are learning. Don't feel bad. Don't feel bad. Number 9. Earlier, we talked about establishing relationship. Now it's time to learn to practice delegation. So you're going to delegate tasks to your nursing assistant, your tech, but in a respectful way. Okay? Because a lot of times new nurses are afraid to delegate to their nursing assistants. But when you develop, that's why I speak about that communication skill. Because when you develop that communication skill, guess what? Delegating will be easy because you have already established that relationship. So when it's time to delegate, you'll be fine. Listen, it's just like speaking to a friend, but it's not a friend. It's a coworker. And the same you want the respect, the same you have to give the respect. Number 10, document everything, guys, and I mean everything. Document accurately and promptly. For example, your patient goes off the unit, document. Patient returns stable, document. Okay? Keep detailed records. Monitoring your vitals, your vital sign. Capture all the information that you really need. 11. That's a lot of tips. Prioritize patient safety. Patient safety probably should be number 1. Double check medications and procedures. Follow protocols and never compromise on patient well-being. Never. Pay attention to details at all times. I always pray and ask myself, Father God, help me to pay attention to all the details daily that's needed and very critical. Number 12, continuously learn and seek opportunity for professional growth. Attend seminars, read journals, and stay updated. Okay. Number 13, embrace teamwork. collaborate with your colleagues, support each other, give support, receive support, share knowledge together. You'll provide best care to your patients when you do this. Okay? And my bonus that I told you about, I'm sure you were waiting. And remember, subscribe. Okay? So, it's a study actually. It's a study that 62% of nurses have symptoms from anxiety, and that's working the night shift. Most new grads are thrown to work in night shift. I'm sure you know this. It's always night shift available, and the same happened to me. And imagine having no experience working nights. Now you are committed to working 12 hour shift at night, and you have absolutely no experience. And my first job as a registered nurse was working nights, and I too suffered from anxiety. And it wasn't pre-shift anxiety because I was happy to go to work. I wanted this. This is my dream. But it's just the shift. The shift was just not for me. I know what it meant when my patient states, now I know what it means when my patient says, I'm anxious, I have anxiety, I'm getting anxiety attack. Now I know, I truly know because I've suffered from it. I later quit that job because they didn't want to switch me to days. So they lost a good nurse. Okay, so I went and I seek other opportunities. So just remember, it's okay to make mistakes, learn from them, and adapt and grow. You are an incredible nurse, and this is an incredible journey. So take every opportunity that you can get to learn and to grow in the field. Thank you for watching the ultimate guide to new nurse success, expert tips and tricks revealed. Okay? If you found this video helpful, please subscribe to my channel. Subscribe to our channel. Comment below some of your expert tips and tricks to help new nurses or novice nurses grow in the field. Your coach, Janisha Dunkley. Bye.